Welcome to San Diego's most popular local morning news. Good morning, San Diego.
Well, according to the Journal of the American Medical Association, an estimated 40 million women experience some form of sexual dysfunction. This morning, Sue Goldstein, the author of a new book called When Sex Isn't Good, joins us with some stories and solutions of women with sexual dysfunction. Good morning.
Good morning, Sandra. Thanks for having me here.
You're very welcome, and congratulations on the book. When Sex Isn't Good, it's definitely an interesting title, and there are interesting stories. You focus on several women who have different problems.
Absolutely. Everybody has different experiences, but what's important to know is that everyone is not alone. There are so many women with problems, but women don't talk about this among themselves, and so they're not aware that other women are suffering with the same problems that they have.
And one of the biggest complaints of women and men is the lack of sexual desire.
That is a huge problem. We call it disparate libido, and one member of the relationship is interested in sex and the other one isn't. There's certainly different levels. Women can be receptive to sex, or they may just turn away altogether. But there are treatments that are available now off-label, meaning they're not FDA approved for the problem. And we also hope that in the near future there will be an approved treatment. We're very excited about that. But it causes relationship problems. If you aren't interested in physical relation with your partner, and he is, it can put a real damper on the entire relationship, not just the sexual relationship, and literally drive a couple apart.
Now, you have been studying sexual dysfunction in women for many years. Do you think that the subject is being taken more seriously now than it used to be?
I certainly hope so. I believe there are so many publications at this point proving that this is a real problem and not just a psychologic problem. It's not that it's not psychologic, but it's only a portion of the problem. I believe now people are taking it more seriously, yes.
Now, last week we talked about a medication that is being studied for depression that has found to boost a woman's desire for sex, and now that is in clinical trials and could be out in the next year or so. Are there other medications out there that you mentioned off-label, but are there things that maybe you could buy at the health food store or natural aphrodisiacs? Do they work, or is that just wives' tale stuff?
That's predominantly wives' tale. There aren't aphrodisiacs. There certainly would be foods that may have some pro-hormone in them, but they're really not at the level that we believe would be helpful. The two major mechanisms for low desire would be central mechanisms, which this new drug flibanserin is addressing, and also hormonal. If your hormone levels are not where they should be, you're not going to experience desire. You're also going to have problems with arousal and orgasm. And one of the things that we believe is in measuring your hormones and making sure they're normal. And if they aren't, we can give you bioidentical, which means hormones similar to what your body makes. And you can then raise your level to where it should be.
Are you talking estrogen and testosterone?
Absolutely. Testosterone in your body will actually convert to estrogen if the aromatase is working in your body. So for many women, just giving testosterone is enough. For some women, it no longer converts. And while the testosterone seems to be a major player for desire, the estrogen also is very necessary for your the physical aspects of your genitalia.
Interesting. Do you now you work at a you work at a medical clinic here in San Diego that focuses on sexual dysfunction in women. Is that something new? You've only been here a couple of years, correct?
We've been here 2.5 years. We treat men and women for sexual health concerns. I'm lucky enough to work with my husband, and he has been treating sexual health issues for almost 30 years, and probably 20 years exclusively only deals with sexual medicine. Most physicians don't have such a focus. Women tend to go to their gynecologist for their sexual health problems, and most of them are not trained, and so they tell women go away for the weekend, and that's one of the biggest problems. So by having a specialty area of sexual medicine, women and men have a place where they can go to someone who is truly knowledgeable in the area.
What % of marriages do you think fail because of sexual problems?
Well, there haven't been any studies, so I can't give you any definitive answer, but I truly believe it's probably a good 60%. I really do. When a man looks for a younger woman, is he looking for a trophy wife, or is he looking for somebody who is still interested in going to bed with him?
Interesting. Well, the name of the book is called When Sex Isn't Good, and you can buy it at what? Barnes & Noble, Amazon.com, all those places?
Correct.
Okay.
Online. It's only available online at the moment.
Very interesting. Sue Goldstein, thanks so much for stopping by.
Thank you for having me.
Best of luck to you.